Well, hello, everyone. Today, in keeping with the theme of the Trinity, I'm providing brief updates on 3 challenges for our ministry in the environment we face. First, the status of the pandemic and its impact on Trinity Health. Second, the opening of the economy and possible implications. And finally, some additional thoughts on our work to recover and resume our outpatient and elective services. First, an update on the status of the pandemic. We continue to see some leveling of the number of new COVID cases and deaths, but the forecasts indicate that the curve is flatter and will last longer than originally modeled. Social distancing is key to reducing the spread of the virus. While the volume of new and suspected patients with the virus is highly variable among our communities, it's not moving quickly toward zero. So we'll continue to maintain our inpatient capacity for those who need us. We'll also continue to do our best to increase testing and buy as much PPE as we can get to maintain a safe environment for our caregivers and support teams. Second, some thoughts on the reopening of the economy. In the communities we serve across the country, some state governors have been aggressive about relaxing stay-at-home orders and opening up businesses quickly. For example, Georgia opened up quickly earlier this month, perhaps too quickly. Others are waiting until May and will be phasing in businesses and services to start up more cautiously. We don't know what the impact of this will be on our communities and on our health ministries. Obviously, we want to avoid more spread of infection and more surges of demand from patients who need hospital care. These surges still have the potential to overwhelm our capacity. And the timing and phasing of opening in each state will also impact our resumption of outpatient and elective services. Your CEOs and leadership teams have access to the forecasting models we're using, and they are planning accordingly, and I know they will continue to keep you informed. Third, our work to recover and resume our services. As I reported in my last video, our revenues are down at least 50%, and we expect the recovery will be slow. Consumer research suggests that at least 60% of patients are fearful of returning to the doctor or hospital while COVID-19 is still active. And the virus will be with us even as the economy is restarted. So wearing masks, social distancing, and increased testing will have to stay in place until a vaccine is available. Optimistically, we expect a vaccine sometime in mid-2021. The good news is that we have teams of leaders and colleagues from across Trinity Health who have developed excellent guidance for the safe resumption of outpatient and elective services, expansion of telehealth and home health care services, and ways to optimize the use of our ambulatory facilities. It really demonstrates the power of being a national system when we can bring together our people and best thinking to develop plans for providing safe care to our communities. We've shared the guidance across our health ministries, and teams are working hard to prepare for resuming these services. It will take time to ramp up, working with our physicians and staffs to bring services back online and build confidence with our communities through extensive communication and engagement. We will also provide support for people who are uninsured and underinsured as a result of unemployment. So in closing, while we have an opportunity for a brighter future, we also have a long, hard road ahead of us. We will look and operate differently as a result of the impact of this pandemic on public health and on the economy. And I recognize the hardship that this has created for many of you and your families. And we're still paving an uncharted path going forward. But at the end of the day, our faith-based ministry is all about people caring for people. In that way, we are one body, and our mission is all about serving the common good. In that way, we are all caregivers. I am grateful for your support, your hard work, and your resolve as we walk this path together. Thank you for all you are doing to move our healing ministry forward. Peace to you all.